So Neha also has asked for, so is breast cancer stage 4 is curable?
Yes, I'm sorry, I'll get to that. So generally stage 4 breast cancer, we tell our patients it may not be curable. Having said that, I've seen like patients with limited metastatic disease, like disease that has spread to minimal locations, like maybe a one spot in the bone or two spots in the bones, or maybe just one spot in the lung or liver. I had patients where we treated them as early stage, like given them chemo or combination of chemo, radiation, or targeted therapy. Some of these patients have been cured. But if there's a lot of the burden, like metastasis, like disease spread into the bones, lungs, liver, brain, I'm just saying different. If the numerous sites, high burden, less likely to be curable. Now I'm talking about breast cancer. It can be very different if you're talking about like another cancer like lymphoma, or you can have stage 4. You can have certain cancers which are stage 4 and can still be cured. Yes.
Okay. So I want to just get a clarity. What is these stages that you are mentioning about? So what we should understand by you telling a stage?
So by general principles, if you have a tumor that's confined, small, and confined to the main organ where it started, that could be a stage 1. For example, like a 2 or 3 centimeter breast tumor or lung cancer, that would be a stage 1. Now, generally speaking, if the cancer goes to lymph nodes, like from the breast to the lymph nodes, multiple lymph nodes, it can be stage 2 or stage 3. Like lung cancer, if it goes into the lymph nodes in the middle of the chest, that could be a stage 3. Now, stage 4, when the cancer leaves that organ, leaves those lymph nodes, but goes to distant organ. When I say distant, outside, it can be liver, brain, bones, opposite lung. That would be stage 4.
Okay.
Yeah. So you cannot, principle of stage 4 is, it's a situation where you cannot do surgery. I mean, you cannot go and do surgery at numerous sites. You do a surgery, you may be doing more harm because, hey, cancer left the main organ. You're doing a surgery, for example, taking out a spot in the liver or taking out a spot in the brain, but there are other cancer cells which we know have already left the main organ and seeded other parts. How are you going to deal with them? You're not going to go do surgery in multiple. By the time you're recovering from one surgery, cancer may be coming back in another organ. So I think what I'm trying to say is, like, when we see stage 4 disease, the treatment is you got to treat the whole body. Like, and that can be chemotherapy or targeted therapy, or I'll come to targeted therapies a little bit later in the conversation. That way I want to introduce you all to what's new in cancer. Okay. Yeah, you got to treat the whole body is what I'm trying to say. Like, that's stage 4.
Got it.